Other states have legalized the recreational use of marijuana. Access and use of marijuana are legitimate subjects which should be discussed. What are the opinions of the candidates?
Hawaii has had a medical cannabis program in place for the past 17 years. However, this program has provided no legal system for patients to obtain their medicine. With the opening of Hawaii's first dispensaries fast approaching, residents are curious as to how the new industry will affect their state economy, their environment, the tourism market, state agriculture, and the people. Great concern and interest surround this previously forbidden plant, and state legislators are well aware of the obstacles placed before them.
Things have been changing, and it's also very difficult for people to get medical marijuana if they're very sick or if they're elderly. To grow it themselves is a challenge.
As savvy entrepreneurs are prepared to capitalize on the nearly 9 million tourists visiting Hawaii annually, and the superior growing environment the land and climate provide. Some do not believe this is the most logical path to Hawaii's ideal future.
What is being ignored is the science and the public health issues, as well as common sense.
Lack of information and strong conflicting moral opinions make it difficult to decipher the actual facts from the fictional myths, while attempting to identify the legitimate experts.
We are the expert, not these people in the Congress and Senate and the judges and the lawyers and the doctors. They don't smoke pot. It's like frowned upon in their culture.
While acknowledging the nearly 20,000 legitimate patients suffering from qualifying conditions and possessing valid recommendations from state-certified medical professionals, state law currently forces these patients to be perceived as criminal when obtaining their medicine from the illegal black market.
Department of Safety still hardline on this. They think if you smoke, you're a criminal, period, end of discussion. Imagine having that person be the boss of the program.
As the Trump administration prepares to assume a more rigid stance against legalized adult-use cannabis, state legislators recognize the risk of possible crime in their communities and illegal activities on their beaches, while differentiating Hawaii as a valid medical health program possessing a robust regulatory scheme.
The law enforcement community is very serious about this issue. They want to make sure people aren't getting marijuana illegally. They want to make sure there's no violence associated with it. But we also wanted to say, no, this is a health program.
Legal or illegal, medical or recreational, starting as early as 2018, Hawaii will acknowledge ailing patients from other states with valid medical recommendations. Some believe this reciprocal action will enable a slippery slope of abuse to crash upon these tropical shores.
We want to prevent a big marijuana industry from being established, which would be like alcohol and tobacco, and that there would be a lot of unintended consequences and social costs to it.
No one knows what is to come down the road ahead. Will it be smooth sailing? What is at the end of this rainbow?
Nobody's dying from pot. What's all this about? It's control. That's all it is.
As the sun sets on the current Hawaii state governor's first term and presumptive candidates prepare to address issues concerning Hawaii's residents in the upcoming year, the same question is placed before them.
Other states have legalized the recreational use of marijuana. Access and use of marijuana are legitimate subjects which should be discussed. What are the opinions of the candidates?
Thank you very much for that question. You know, marijuana is a Schedule I drug classified by the federal government, which means that it is illegal for you to possess, distribute, sell. And, you know, I just really believe that our laws should be consistent. You know, until the federal government takes action to legalize marijuana, I think it's inappropriate for the state to legalize it. You know, I voted against the medicinal use for marijuana, and it really was because there was no legal way to get it. I couldn't understand how you would tell a patient that they could use it for medicinal purposes, but the only way you could get it is to buy it from a drug dealer or get the plants and grow it yourself. So I am open to the notion of dispensaries regulated and figuring out some way for people who do need it for medicinal purposes to be able to get it without going to a drug dealer.